Calling Congress is all about advocating at the federal level, but policy change happens at the state level too. Today, we're going to talk to you a little bit more about how you can get involved in your community.
Hi, my name is Aubrey Thalen, and I am Fight CRC's Advocacy Manager. Fight CRC's State Proclamations campaign is a great way to get engaged with advocacy if you've never done it before. By securing a state proclamation for Colorectal Cancer Awareness Month, new and old advocates can do a couple things. It raises awareness in your community and state around colorectal cancer. It creates relationships with your governor's office or maintains them if you've done this before. You never know when you might need that connection. It also generates media opportunities. That means press releases, media coverage, or even an in-person signing with your governor. So how can you as an advocate get involved with our proclamations program? First, you're going to visit fightcrc.org/proclamations to sign up for our toolkit, and that will walk you through the process of submitting and securing a proclamation. Every state is different, so we provide a set of resources for you to be successful. First is a state-by-state outline of what is required to submit a proclamation request in your state and how to contact to follow up. We also include a formal request letter if needed and a sample proclamation. Your state may need to shorten this slightly, but you're all set with the example. Beyond submission, 4 to 8 weeks in advance of March, you should check in with your governor's office every couple of weeks to keep colorectal cancer at the top of their list. These are opportunities to build that relationship and potentially schedule an in-person signing. Lastly, let us know at advocacy@fightcrc.org when you submit and when you receive your proclamation so we can track which states are turning blue for colorectal cancer awareness. Post a hashtag #StrongArm selfie to your social media feeds as well and tag FightCRC to celebrate, and we will repost it. So you've submitted your proclamation and you want to do more? Visit our partners' website, the Colon Cancer Coalition, for their #Blue4CRC campaign. This guides you through more local proclamations and how to light up landmarks blue for more colorectal cancer awareness. Does this seem like a lot of information? Don't worry, the toolkit helps, but here's Kansas advocate, Fight CRC ambassador, and survivor, Beth Cornegay, to talk a bit about how easy the process is.
So when I talk about how I received the proclamations and the processes involved, know that every state's going to be a little bit different. So in the state of Kansas, there's some paperwork that's required, and I actually found it on the governor's website. So it's like stateofkansas.gov, and there's a button for proclamations. I'm actually securing the 4th proclamation for the state of Kansas. And the first time I did it, I was a little bit intimidated, but it really wasn't that difficult at all. So the first proclamation I got was in 2018. And I sent the request in, and you can actually either request, again, in the state of Kansas, you can request either an in-person signing, or you can request just for the proclamation to be signed and it sent out to you. So of course, I want the in-person signing. You know, I want the great photo op with our governor. Well, at that time, the state of Kansas, the governor was an MD. His name is Dr. Jeff Collier. And so when I was visiting with him during the signing of the proclamation, I actually found out that he lost his brother 10 years prior to that to colorectal cancer. It hit very close to home for him as well. So he was very happy to meet myself and another nearby colon cancer survivor as well. She was from Topeka. Again, it's just really easy to do. It's a great PR thing. I think it does help raise awareness. And I know the first year that I had the in-person signing, there's so many people, there's so many different groups. In the state of Kansas, they actually allow half a day, one time a month. So all the proclamations that are requested come in and they're signed, like the first Wednesday of the month from 9 a.m. to noon. And then all the groups are lined up together. And I know in 2018, there was, March was also like severe weather Awareness Month. And then there was another group that was getting a proclamation about military dogs and their service. So there's a variety of things that are happening other than just colorectal cancer awareness month. So again, it's very easy to do. I know I'm helping a fellow colon cancer survivor get the Missouri state proclamation secured, and I've sent him the information, and I'm sure that'll be coming along very soon.
In 2019, Fight CRC launched the Catalyst State-by-State Advocacy Program. The goal of the program is to support coalitions at the state level to advance legislation to increase access to colorectal cancer screening. Since the program's creation, we've worked with coalitions at the state level to ensure access to colorectal cancer screening beginning at age 45 in accordance with American Cancer Society guidelines, as well as remove out-of-pocket costs for patients needing a colonoscopy following a positive non-invasive test. Since we launched Catalyst, we provided funding to a total of 8 states: Arkansas, California, Colorado, Louisiana, Kentucky, Nebraska, Texas, and Rhode Island. Ultimately, we hope to expand to all 50 states. When states become a Catalyst grantee, we not only provide them funding to help them advance policy work, but also technical assistance and support with action planning. Some health insurance plans are regulated at the federal level, while others are regulated at the state level. So it's important to engage with both your state and federal elected officials to ensure access to colorectal cancer screening. Also, state legislatures are very active. As we saw with the Medicare loophole bill, change at the federal level can take a lot of time. But at the state level, things can move really quickly. So it's important that we are engaged there to make sure that colorectal cancer is a priority. So if your state is a Catalyst grantee and you're looking to get involved, go to fightcrc.org/catalyst and check out your state's page. You'll find more information about colorectal cancer screening in your state, as well as contact information for your coalition leader. If your state isn't a grantee, you can still go to our website and find a one-pager on the colorectal cancer landscape in your state. You can also check out our Action Center and sign our pledge to make sure your state allows screening for colorectal cancer beginning at age 45. Next, you'll hear from a few people who are involved in the Catalyst program to learn more about their experience advancing policy to increase access to colorectal cancer at the state level.
Hi, I'm Christy Cahill. I'm the Executive Director for the Colorado Cancer Coalition, and we are the statewide network dedicated to improving the lives of Coloradans touched by cancer. My role within the Catalyst program is to oversee our grant and really encourage our task force members and coalition members to get involved with the Catalyst grant and legislative policy in the state. The Colorado Cancer Coalition applied for a Catalyst grant in 2019 because we've had a very active colorectal cancer task force for over 20 years, and the time was right to start doing more legislative change, with colorectal cancer being the second leading cause of cancer death in Colorado, and actually on the rise in young women in Colorado. It was the time. When we became a Catalyst grantee, we received access to a lot of different resources. I would say the first being most important was access to Molly and Aubrey's expertise. Having them to ask questions has been a great asset to us and really helped expand my knowledge in the legislative arena. And also the action planning, technical assistance, and connections with other states has been also really valuable. The webinars that shared best practices from other states really helped us brainstorm ideas. For example, I have loads of toilet paper in my garage. So as soon as we get the call that the legislators are going to read our colorectal cancer proclamation, I'm driving down there with our fact sheets and the toilet paper, and we're going to pass out toilet paper and fact sheets to all of the legislators. The benefit of being a Catalyst grantee is that it has intentional strategy and infrastructure built into the entire program, and it really helps give a framework that each state can individualize to their own needs. Every state's unique, and it has really let us do what is right for Coloradans. So last year, like many, our bill stalled due to COVID-19, but luckily with the USPSTF likely coming out with the guideline change to 45, we follow that. So we actually took that off of our legislative list for this year and went back to the drawing board. So Fight CRC helped us with a strategic planning process and really put everything in motion to reprioritize where we needed to go next for colorectal cancer screening in Colorado. So if you live in Colorado and want to advocate for colorectal cancer, we would love to have you join our colorectal cancer task force. They meet monthly and have various work groups, and your story and your expertise, no matter where you are in your journey, or even if you work in the colorectal cancer space, your story is needed, and there's a space for you with the Colorado Cancer Coalition. So join our task force. You can also sign up for emails on our website, or you can even send me an email at Christy@coloradocancercoalition.org. I want to hear your story and help you get your story out there so that we can get more Coloradans screened for colorectal cancer.
Hi, I'm Lance Barber. I am on the state and local campaigns team for the American Cancer Society Cancer Action Network, or ACS-CAN as we like to be called. My portfolio areas consist of colorectal cancer initiatives. So I help all 50 states pass policy, whether legislative policy or through the regulatory process to reduce colorectal cancer incidence and mortality rates throughout the country. ACS-CAN has the privilege and honor to sit on the advisory council for Fight CRC for the Catalyst Grant Program. We help to review the grant applications as they come in for a particular grant cycle. We provide input on state readiness for the particular policy initiative that the state is looking at passing over the awarded grant cycle. And so when grants are awarded, we like to work with partners on the ground. We have staff in all the states that can help to sort of strategize and come up with a strategic plan to pass the policy that the grant applicants have applied for. And then we sort of work together to move the initiatives forward. So we help to do some advocacy planning, some strategic planning, some direct action organizing, just to make sure that everyone's on the same page and we understand what goals and what processes we need to go through to achieve that. I think partnering with Fight CRC on the Catalyst program is vitally important. It brings various stakeholders to the table, the various individual advocates who are very passionate about this issue, whose lives have been touched by colorectal cancer, various partner organizations, and it just helps us all to move forward together to achieve a policy win. We know that it's hard just to do that with one particular organization or one person passing an initiative, but when there's a group of people sort of pushing for the same thing, it brings a bigger light and more attention to the issue and what we're trying to achieve.
My name is Allison Rosen. I am a stage 2 colorectal cancer survivor. I am a very passionate advocate, and I also happen to work in cancer prevention. So a little bit about my story briefly. I was working in cancer research when I was diagnosed with colorectal cancer. So obviously, as a researcher, I never thought I would get cancer myself. Unfortunately, I did, but I had enough support and knowledge, and I lived in Houston, Texas, which, you know, having access to great medical care was amazing for me. Not everyone has that, but I was lucky that I did. So I was able to walk across the street from where I worked to my appointments at MD Anderson. I had, you know, I could go into hours and hours, but briefly, I had chemotherapy, radiation, 3 open surgeries. Now I'm cancer-free 8 years, and I'm on a permanent ostomate. So after everything that I went through, I realized that I wanted to become an advocate and sort of change career paths, and now I work in cancer prevention as well. So I first got involved with the Catalyst program just by knowing. I was a Fight CRC ambassador in 2018, and I'm also American Cancer Society Cancer Action Network volunteer here in Texas. And so I know a lot about policy work. And when I heard about the Catalyst program, I actually watched a webinar about what was being done in some other states, Kentucky, a few other states. And I was really passionate about having that legislation happen in Texas just because of living here and my cancer journey and everything that I do related to policy. So when I saw that webinar, I reached out to our ACS-CAN leadership and asked them, could we apply for this? Because I think it would really help boost momentum and get the ball rolling with getting legislation in Texas for colorectal cancer on board. I think the most impactful thing I've done as part of the Catalyst program here in Texas is help bring healthcare professionals that I've worked with here in Texas, as well as patient caregivers and advocates together to form sort of a committee to help make this initiative successful. So through my everyday work and through my advocacy, I know a lot of different people, and I know a lot of people that are invested in the colorectal cancer world, especially here in Texas. And so bringing the right people and the right stakeholders to the table to make it a success, I was helpful in that. And so I think, you know, that's a huge success for me, as well as the future of what happens as far as this policy work in Texas. So as a advocate or survivor, patient, caregiver, the different asks as far as working on a policy campaign can be anything from telling your story or to reaching out to your representatives or senators. Really, it's as much or as little as you want to do. If you're not comfortable speaking, you can help recruit other people to speak. There's opportunities to get to talk to the media, to spread awareness. So really, it's whatever you're comfortable with. Obviously, I'm comfortable with talking and telling my story. So I personally have been, you know, able to write a letter to the editor for our local paper, been able to talk to media. I've been able to help recruit people, like I said earlier, but it's as little or as much as you want to do. And I've said this zillions of times, every story matters. So no matter if you think your story is not that interesting or important, it is. Every story can help make this legislation successful. It's so important for me to take part in the Catalyst program in Texas, just because of my vested interest, not only as a survivor, but someone that sees people that are affected by colorectal cancer all day, every day. I think cancer prevention is so important. And so with this program and what we're able to do with it, we can help save lives. No matter if the policies change right now, which I'm confident it will be through the Catalyst program and the legislation and the meetings that we're going to have, I think we can be successful in spreading awareness to the people in Texas that the screening age is suggested, at least by American Cancer Society, for 45 and above. So it was so important to me as a survivor, as a patient, as someone that works in the community, to use my voice, to use the people that I know, to use my leverage to make sure that this campaign can be as successful as possible.